Beat AML Master Trial is an umbrella study that requires genomic screening upon entry into the study. The study primary endpoints of the study are the ability to make a treatment decision within 7 days, followed by the efficacy of the individual studies. It's a multi-institutional study with 11 sub-studies represented by 7 pharmaceutical companies, so we cover the most prominent subtypes of AML. The results of the study show that we have the ability to make a treatment decision in 94.7% of the patients that have enrolled in the study, achieving the primary endpoint of the study. Approximately 50% or more go on to the assigned treatment, and with that we see a low early death rate of 3.7% for patients that are on the Beat AML study compared to patients who are on standard of care, which had an early death rate of 20.4%. This is consistent with the data that was presented last year by the Alliance Cooperative Group Synthetic Control Study, where they showed an early death rate of 17.1% to 41%, depending on the molecular group. Ultimately, we concluded that it is safe to delay treatment by up to 7 days for patients in this older AML patient population. And looking further at the overall survival of these patients, we see an increased survival for patients that are treated on the Beat AML study with a median of 12.8 months compared to patients who elected the standard of care that had a median of 3.9 months. And patients who elected to go on to an alternative clinical trial outside of the Beat AML study, the median was not reached and we could not see a difference in the overall survival. So ultimately, we concluded that patients who go on to the assigned therapy have a lower rate of mortality and a superior overall survival compared to patients who elected standard of care. And the study has the potential to increase the short-term and long-term outcomes of patients in this AML patient population.